Today I'm talking to Dr. Anita Jayakumar about hearing loss in children. Doctor, thanks for taking time to be with us today.
Sure.
So let's talk about how common is it, first of all, and how does this impact children?
It's actually quite common. So when you start from babies, about 2 to 4 babies per 1,000 are born with permanent hearing loss. And really most of our conversation today is going to be about permanent hearing loss. As you go up in age, the incidence gets higher to the point that when you're 75, well, I know we're not talking about adults today, but when you're 75, you have a 50% chance of having permanent hearing loss.
Wow.
So it's quite significant.
Those numbers are high. A lot of parents might be surprised that their baby is being screened for hearing loss. There's a reason for all of this.
Absolutely. So first of all, it's state and federal law that a baby is screened for newborn hearing when they are born before they leave the hospital. So that is law.
Okay.
Obviously, screening a baby is very different from putting headphones on an adult and saying raise left hand, right hand. So screening in a baby is really based on reflexes. And there are two kinds of screens that are done in different hospitals depending on what the facilities are, what the acute care needs of the baby are, the acuity of the baby. All of that guides how they need to be tested.
And then I guess for older children, parents need to watch out for certain signs, symptoms. What can lead to hearing loss at that point before we get into the things to watch out for?
There are so many things that can lead to hearing loss. Probably the most common, which is not very well known, is a genetic cause of hearing loss. But certainly noise trauma from overuse of headphones, going to concerts, using firearms without protection, all of those things can cause permanent damage to hearing. And in humans, we're mammals. Mammals don't repair our hair cells, which are what get damaged with noise trauma. And so once the hearing is gone,
it's gone.
It's gone.
Wow. What are the things to look for once your child is older as a parent?
So can we start with babies first?
Absolutely.
I know we're talking about,
yes.
So it is really important that if a baby fails a newborn hearing screen, they do the required follow-up.
Okay.
Because the goal for kids to do well is that they need to be identified early, because they need intervention early for them to do well. The data shows that if a child's not identified early or a child has untreated hearing loss, they have an almost 50% chance of not finishing high school. So huge impact-wise and economy-wise. In older kids, it's a little more complicated because you have selective hearing. And selective hearing is normal hearing, but selective. So in older children, I'd say look for patterns. If they're always asking, if the TV volume is turned up really loud, if you can't get a conversation with them across from one room to the other, or if they're having performance issues in the classroom, those are all things to just worry about to make sure that there is not a hearing issue.
Are there hearing issues that can be treated surgically?
Absolutely. Majority of hearing loss can be treated with hearing aids. Okay. Good old-fashioned hearing aids that really are not old-fashioned anymore. Yes.
Yes.
But if they are beyond the realms of a hearing aid, then we can do a surgery called a cochlear implant, which is a surgically implanted device that they will use in addition to speech therapy to learn how to hear sound. And it's usually for kids who cannot get benefit from a hearing aid. Also, if they have a condition like no ear, like physically no ear,
right,
there are certain bone conduction devices that you can put in to get sound to the inner ear.
In addition to all of this, which is really inspiring and great, are there any new treatments on the horizon for treating hearing loss?
We probably are knocking on the era of gene therapy. Okay. Not there yet, but at some point, probably in my life, we'll be able to identify a gene causing hearing loss and be able to treat the child. However, I usually tell my parents not to wait for that because auditory deprivation or no sound in a child means that if you're waiting, they go longer without sound and then they don't do well cognitively. So even though the therapy is in the horizon, I would say let the therapies be established and tried and true, and then we can bank on them.
Bottom line is, I think at the end of the day, it's being really in tune with your child.
Absolutely.
Yeah. Doctor,
Absolutely.
Thank you so much for all of this
today.
Thank
you for your time.